Question 1. A certified medication aide, CMA, is preparing to administer medication to a client. Which of the following is the most critical step to ensure client safety before administering any medication? A. Checking the client's vital signs. B. Washing hands thoroughly. C. Confirming the client's identity using two identifiers. D. Reading the medication label 3 times. Answer: C. Confirming the client's identity using two identifiers. This question tests your understanding of the right client safety check, which is paramount in medication administration. The most critical step before giving any medication is to correctly identify the client using at least 2 independent identifiers, such as their full name and date of birth, and comparing them to the medication administration record, MAR. Incorrect client identification can lead to severe medication errors, which washing hands or reading the label, while important, cannot prevent. For instance, if 2 clients have similar names, using 2 identifiers ensures you give the right medication to the right person. Always remember, confirming client identity is a foundational safety practice that prevents serious mistakes. Question 2. A client refuses to take their prescribed medication. What is the appropriate initial action for the certified medication aide, CMA, to take? A. Insist the client takes the medication for their health. B. Document the refusal and notify the charge nurse. C. Crush the medication and mix it in food without telling the client. D. Leave the medication at the bedside for the client to take later. Answer: B. Document the refusal and notify the charge nurse. This question addresses the client's right to refuse medication and the CMA's correct response to it. The key concept here is respecting client autonomy and following proper procedure when a client declines medication. You must never force a client to take medication or administer it deceptively. Instead, you should document the refusal accurately on the medication administration record, MAR, and immediately inform the licensed nurse. This allows the nurse to assess the reason for refusal, educate the client, or explore alternative solutions, maintaining client safety and professional responsibility. For example, if a client says the pill is too big, the nurse might be able to get a liquid form. Always remember that client refusal must be documented and reported, never ignored or circumvented. Question 3. A CMA is administering an ophthalmic eye ointment. After applying the ointment, what instruction should the CMA give the client? A. Blink rapidly several times. B. Rub your eye gently to spread the ointment. C. Close your eye gently for 1 to 2 minutes. D. Immediately rinse your eye with water. Answer: C. Close your eye gently for 1 to 2 minutes. This question tests the specific technique for administering ophthalmic ointment effectively. The crucial part of administering eye ointment is ensuring the medication has time to be absorbed and spread across the eye's surface without being immediately washed away or pushed out. Gently closing the eye for a short period helps distribute the ointment properly and prevents it from being squeezed out, maximizing its therapeutic effect. Rubbing or blinking rapidly can irritate the eye and push the medication out, while rinsing it with water would remove the medication. Imagine applying a healing balm. You want it to stay on the affected area to work. The best way to remember this is that eye ointments need gentle, still time to spread and absorb. Question 4. When preparing to administer a controlled substance, such as an opioid pain medication, what additional step must the CMA always perform? A. Ask the client to state their pain level before and after administration. B. Secure the medication in a locked drawer after administration. C. Verify the count of the controlled substance with another CMA or nurse. D. Document the medication on a separate, specialized controlled substance log only. Answer C. Verify the count of the controlled substance with another CMA or nurse. This question focuses on the strict protocols for controlled substances, which are designed to prevent diversion and ensure accountability. The critical step is to have another qualified person, like another CMA or a licensed nurse, witness and confirm the exact count of controlled substances before you take out a dose and after you return it. This dual verification process, often done at the beginning and end of each shift or when accessing the medication, is a legal requirement for security and tracking. For example, if you are removing one tablet, both you and the witness would count the remaining tablets to ensure the record is accurate. Always remember that controlled substance administration involves double-checking inventory with a witness to maintain strict control and accountability. Question 5. A CMA finds an unlabeled medication syringe on a client's bedside table. What is the immediate and most appropriate action? A. Administer the medication if it looks familiar. B. Ask the client if they know what the medication is. C. Discard the syringe and document the incident. D. Label the syringe based on the client's current medication list. Answer C. Discard the syringe and document the incident. This question emphasizes medication safety, specifically regarding unlabeled medications. The most important concept here is that any medication without a proper label is considered unsafe and potentially dangerous because its identity, dosage, and expiration are unknown. You must never administer an unlabeled medication, ask the client to identify it, or attempt to label it yourself, as this can lead to severe medication errors. The correct and safest action is to immediately discard the unlabeled syringe according to facility policy and thoroughly document the discovery and disposal as an incident. Think of it like a mystery pill. If you don't know what it is, it's safer to assume it's harmful. Always remember, when in doubt about a medication's identity due to lack of a label, never administer it and safely dispose of it. Question 6. A CMA is scheduled to administer a medication that requires assessment of the client's apical pulse before administration. If the CMA finds the pulse rate is 52 beats per minute, what should be the immediate action? A. Administer the medication as scheduled. B. Withhold the medication and notify the charge nurse. C. Administer half of the prescribed dose. D. Document the pulse rate and reassess in 30 minutes. Answer B. Withhold the medication and notify the charge nurse. This question tests your critical thinking regarding pre-administration assessments and knowing when to withhold medication. The crucial clue is the normal range for an apical pulse, which is typically 60 to 100 beats per minute for adults. 52 bpm is considered bradycardia, a slow heart rate. For medications like digoxin or certain beta blockers that can further lower heart rate, a pulse below 60 bpm is often a contraindication for administration. In such a scenario, you must withhold the medication and promptly inform the licensed nurse, who will assess the client and decide on the next steps. For example, if a client is prescribed a medication that slows the heart, giving it when their pulse is already too slow could be dangerous. Always remember, never administer a medication if a pre-administration assessment reveals a parameter outside the safe range specified by the nurse or policy. Question 7. After administering a client's medication, the CMA realizes they forgot to document it on the medication administration record, MAR, immediately. What is the appropriate action? A. Document it as soon as possible, including the time it was given. B. Wait until the next medication pass and document both doses at once. C. Ask another CMA to document it for you. D. Do not document it, as it's too late and might look like an error. Answer A. Document it as soon as possible, including the time it was given. This question highlights the importance of timely and accurate documentation in medication administration. The key concept is that all medications given must be documented, and it's best practice to do so immediately after administration to prevent errors like double dosing or omissions. If you forget to document immediately, the correct action is to document it as soon as you realize your oversight, making sure to include the actual time the medication was administered. This maintains an accurate record of care and prevents potential confusion for others involved in the client's care. For instance, if you gave a pain medication at 10:00 a.m. but forgot to chart it until 10:30 a.m., you chart it at 10:00 a.m. Always remember, if you administered it, you must document it, even if slightly delayed, to ensure accuracy and client safety. Question 8. A client on a transdermal patch for pain relief complains that their pain is not controlled. Upon assessment, the CMA notices the patch is partially detached. What should the CMA do? A. Apply strong adhesive tape over the patch to secure it. B. Remove the current patch, clean the area, and apply a new patch in a different location. C. Press the edges of the patch firmly down to re-secure it. D. Document the partial detachment and notify the charge nurse for further instruction. Answer: D. Document the partial detachment and notify the charge nurse for further instruction. This question tests your understanding of proper transdermal patch management and when to seek guidance. When a transdermal patch is partially detached, its ability to deliver the correct dose of medication is compromised, leading to ineffective pain control. The most appropriate action is to document the observation and immediately notify the charge nurse, as only a licensed nurse can determine if the patch needs to be resecured, reinforced, or replaced. CMAs typically do not have the authority to make clinical decisions like replacing a patch without a nurse's assessment and order. For example, some patches cannot simply be readhered, and replacing it might lead to an overdose if the original patch still delivered some medication. Always remember, compromised transdermal patches require assessment and direction from a licensed nurse. Question 9. When administering an oral medication, the CMA should always observe the client to ensure they have swallowed the medication. What is the primary reason for this observation? A. To prevent the client from cheeking the medication. B. To ensure the client has enough water with the medication. C. To check for signs of an allergic reaction immediately. D. To confirm the client is conscious and alert. Answer: A. To prevent the client from cheeking the medication. This question focuses on a crucial safety practice in oral medication administration. The primary reason for observing a client swallow their medication is to ensure that they have truly ingested it and not cheeked it, held it in their mouth without swallowing, or spit it out. Clients, especially those with cognitive impairments or those who are resistant to medication, may try to avoid taking their dose. Observing swallowing directly confirms that the medication has entered their system, guaranteeing the right dose and right route of the 5 rights. For instance, if a client cheeks their medication, it means they are not getting the prescribed dose, which could affect their treatment. Always remember, direct observation of swallowing confirms the medication has been taken as intended. Question 10. A client with diabetes receives insulin subcutaneously. The CMA knows that the most important aspect of insulin administration is A. Rotating injection sites frequently. B. Administering it into a muscle for faster absorption. C. Ensuring the client eats immediately after administration. D. Using a warm compress on the site before injection. Answer: A. Rotating injection sites frequently. This question assesses knowledge about safe and effective insulin administration. The most important aspect of subcutaneous insulin administration is the frequent rotation of injection sites, e.g., abdomen, thighs, upper arms. Consistent use of the same site can lead to lipohypertrophy, which is a thickening of the fatty tissue that can impair insulin absorption and lead to unpredictable blood sugar levels. While other options might be relevant in certain contexts, site rotation directly impacts the medication's effectiveness and prevents complications. For example, if insulin is always injected in the same spot, that area can become lumpy, making future injections less effective. Always remember, rotating injection sites is vital for consistent insulin absorption and to prevent tissue damage. Question 11. Which of the following is an appropriate action for a CMA when a client complains of a new rash and itching shortly after receiving a new medication? A. Advise the client to apply a cold pack to the rash. B. Document the observation and administer an antihistamine. C. Immediately stop the medication and notify the charge nurse. D. Tell the client it's likely a mild side effect and will pass. Answer: C. Immediately stop the medication and notify the charge nurse. This question tests your ability to recognize and respond to potential adverse drug reactions, specifically an allergic reaction. A new rash and itching after starting a medication are classic signs of an allergic reaction, which can quickly become severe. The most appropriate and safest action is to immediately withhold any further doses of the suspected medication and promptly report your observations to the licensed nurse. Administering other medications or dismissing the symptoms without a nurse's assessment could put the client at significant risk. For instance, continuing a medication that causes an allergic reaction could lead to anaphylaxis, a life-threatening condition. Always remember, any signs of a new allergic reaction warrant immediate discontinuation of the medication and prompt notification of the charge nurse. Question 12. A CMA is asked by a client's family member to explain why a certain medication is prescribed. What is the CMA's most appropriate response? A. I'm not allowed to discuss specific medications with family members. B. You should ask the client's doctor or the charge nurse about that. C. This medication is for condition, as written on the MAR. D. I can't provide that information due to client confidentiality. Answer: B. You should ask the client's doctor or the charge nurse about that. This question addresses the scope of practice and confidentiality for a certified medication aide. CMAs are not licensed to provide detailed medical information, diagnosis, or treatment explanations to clients or their families, as this falls under the scope of a licensed nurse or physician. While client confidentiality, HIPAA, is important, a direct refusal without guidance isn't the most helpful approach. The most appropriate response is to politely refer the family member to the licensed nurse or physician, as they have the expertise and authority to discuss medication rationale and client conditions. For example, telling them to ask the nurse empowers them to get accurate, comprehensive information. Always remember, CMAs provide direct care and medication administration, but clinical information and explanations are the responsibility of licensed healthcare professionals. Question 13. When administering a medication that needs to be given with food, what is the best explanation for this instruction? A. Food helps the medication absorb faster into the bloodstream. B. Food prevents stomach irritation and improves medication tolerance. C. Food helps to mask the taste of unpleasant medications. D. Food ensures the medication is eliminated more quickly from the body. Answer: B. Food prevents stomach irritation and improves medication tolerance. This question tests your basic understanding of why certain medications have specific administration instructions. The primary reason some medications are prescribed with food is to reduce gastrointestinal upset, such as nausea, indigestion, or stomach irritation, that the medication might cause on an empty stomach. Food acts as a buffer, making the medication more tolerable for the client. It typically does not speed absorption or mask taste as its main purpose, and it doesn't necessarily help with faster elimination. For instance, aspirin or certain antibiotics are often taken with food to prevent an upset stomach. Always remember, with food usually means protecting the stomach and making the medication easier to tolerate. Question 14. A CMA is administering medication to a client who appears to be sleeping soundly. What is the best initial action? A. Gently wake the client to administer the medication. B. Administer the medication while the client is sleeping to avoid disturbance. C. Skip the dose and document that the client was sleeping. D. Withhold the medication and notify the charge nurse. Answer. A. Gently wake the client to administer the medication. This question addresses the importance of client participation and safety during medication administration. It is crucial to gently wake a sleeping client to ensure they are fully alert and able to cooperate with medication administration, confirming their identity and safely swallowing oral medications. Administering medication to an unresponsive or deeply sleeping client can lead to choking, aspiration, medication entering the lungs, or other safety hazards. Skipping the dose without the nurse's approval is also incorrect, as it disrupts the prescribed treatment regimen. For example, if you try to give a pill to someone who is not fully awake, they might choke. Always remember, ensure the client is awake and responsive before administering any medication. Question 15. A client's prescribed medication label states administer 1 tablet PO daily. What does PO mean? A. Per rectum. B. As needed. C. By mouth. D. Right eye. Answer. C. By mouth. This question tests your knowledge of common medical abbreviations essential for safe medication administration. The abbreviation PO stands for per os, which is Latin for by mouth or orally. Understanding these abbreviations is critical for administering medications via the correct route, which is one of the 5 rights of medication administration. Misinterpreting this abbreviation could lead to administering the medication incorrectly, potentially causing harm to the client. For example, if you didn't know PO meant by mouth, you might mistakenly think it meant another route. Always remember, PO means by mouth, a fundamental abbreviation for oral medications. Question 16. The CMA prepares to give a client a liquid medication. After pouring the dose, the CMA notices some medication spilled on the outside of the measuring cup. What should the CMA do? A. Wipe the cup clean and administer the remaining medication. B. Add more medication to compensate for the spill. C. Discard the dose and prepare a new, accurate dose. D. Administer the dose and note the spill in the documentation. Answer. C. Discard the dose and prepare a new, accurate dose. This question focuses on accurate dosing and preventing medication errors. When a liquid medication spills, even on the outside of the cup, the accuracy of the dose becomes compromised because you cannot be certain of the exact amount remaining. The most appropriate and safest action is to discard the entire dose and prepare a fresh, accurate dose. Attempting to estimate or compensate for the spill can lead to underdosing or overdosing, which could harm the client. For example, if you spill part of a critical heart medication, giving the remaining amount might mean the client doesn't get enough to be effective. Always remember, If a medication dose is compromised by a spill, always discard it and prepare a new, accurate dose. Question 17. A CMA is preparing to administer medication from a multi-dose bottle. What is the most important action to prevent cross-contamination? A. Labeling the bottle with the client's name. B. Always using a clean medication cup for each client. C. Wiping the bottle rim with an alcohol swab before and after use. D. Storing the bottle in a cool, dark place. Answer: B. Always using a clean medication cup for each client. This question highlights a fundamental principle of infection control in medication administration. The most important action to prevent cross-contamination when using a multi-dose bottle for multiple clients is to always use a clean, separate medication cup for each client. This prevents the transfer of germs from one client's cup or hands back into the shared medication bottle, which could then spread to other clients. While labeling is important for client safety and storage is important for medication integrity, using individual cups directly addresses cross-contamination. For example, if you use the same cup for multiple clients, any germs from one client's mouth could be transferred to the medication others receive. Always remember, separate, clean medication cups for each client are essential to prevent cross-contamination from multi-dose bottles. Question 18. The medication administration record, MAR, indicates a medication should be given TID. How many times a day should this medication be administered? A. Once a day. B. Twice a day. C. 3 times a day. D. 4 times a day. Answer: C. 3 times a day. This question tests your knowledge of common medical abbreviations related to medication frequency. TID is a standard abbreviation derived from the Latin ter in die, which means 3 times a day. Accurately interpreting medication frequencies is crucial for administering the right time and right dose of the 5 rights, ensuring the client receives their medication as prescribed and maintains therapeutic levels. Misunderstanding TID could lead to underdosing or overdosing, impacting the medication's effectiveness and client safety. For instance, if a medication is for pain, giving it only once instead of 3 times would leave the client in pain. Always remember, TID means 3 times a day, and knowing these abbreviations is key to safe medication timing. Question 19. A client reports that the last time they took a specific antibiotic, they developed severe diarrhea and stomach cramps. What should the CMA do before administering this antibiotic? A. Administer the antibiotic as ordered, but monitor closely for side effects. B. Document the client's report and notify the charge nurse immediately. C. Tell the client that diarrhea is a common side effect of antibiotics. D. Suggest the client take the antibiotic with a probiotic to prevent symptoms. Answer: B. Document the client's report and notify the charge nurse immediately. This question focuses on client assessment and reporting, particularly concerning adverse effects. A client's report of severe diarrhea and stomach cramps from a previous dose of an antibiotic is a significant concern that could indicate an adverse reaction or intolerance. It is essential to document this report and immediately inform the licensed nurse, who will assess the client's history, evaluate the current order, and determine if it's safe to proceed with the medication. CMAs do not have the authority to make clinical judgments about medication safety in such situations. For example, continuing an antibiotic that caused severe gastrointestinal distress could lead to a more serious condition like C. difficile infection. Always remember, any client report of previous severe adverse reactions to a medication must be reported to the charge nurse before administration. Question 20. When preparing medications for more than one client, what is the safest practice for the CMA? A. Prepare all medications for all clients at once, then go administer them. B. Prepare medications for one client at a time, administer them, then move to the next client. C. Place all prepared medications on a tray and label each dose with the client's name. D. Ask another CMA to double-check all medications before administration. Answer B. Prepare medications for one client at a time, administer them, then move to the next client. This question addresses a critical safety measure in medication administration, particularly for preventing errors when managing multiple clients. The safest practice is to prepare, administer, and document medications for one client completely before moving on to the next client. This method minimizes the risk of administering the wrong medication to the wrong client, a common and dangerous error. It reduces distractions and helps maintain focus on the 5 rights for each individual, rather than juggling multiple sets of medications. For instance, if you prepare medication for client A, administer it, and then go to client B, you are much less likely to mix up the medications than if you prepared all medications at once. Always remember, focus on one client at a time for medication preparation and administration to significantly reduce errors. Question 21. A client who has difficulty swallowing, dysphagia, is prescribed a tablet. What is the CMA's best initial action? A. Crush the tablet and mix it with a small amount of applesauce. B. Ask the charge nurse if the medication can be ordered in a liquid form. C. Instruct the client to take small sips of water with the tablet. D. Document the client's difficulty swallowing and skip the dose. Answer B. Ask the charge nurse if the medication can be ordered in a liquid form. This question focuses on adapting medication administration for clients with specific needs, like dysphagia, while staying within a CMA's scope. While crushing a tablet might seem like an immediate solution, not all tablets can be safely crushed, e.g., extended release, enteric-coated medications. The safest and most appropriate initial action for a CMA is to consult the licensed nurse. The nurse can determine if the medication can be safely crushed, if an alternative liquid form is available and ordered, or if another solution is necessary, ensuring client safety and medication effectiveness. For example, if a client has trouble swallowing a tablet, the nurse might be able to get an order for a syrup version of the same medication. Always remember, consult the nurse for clients with swallowing difficulties before altering medication forms or administration methods. Question 22. Which action by a CMA demonstrates proper hand hygiene according to infection control guidelines before medication administration? A. Washing hands with soap and water for 5 seconds. B. Using an alcohol-based hand rub for visibly dirty hands. C. Washing hands with soap and water for at least 20 seconds. D. Wearing gloves instead of washing hands. Answer C. Washing hands with soap and water for at least 20 seconds. This question directly tests your knowledge of fundamental infection control practices. Proper hand hygiene is the single most effective way to prevent the spread of infection, and it's essential before any client contact or medication administration. According to Centers for Disease Control and Prevention, CDC, guidelines, hands should be washed with soap and water for at least 20 seconds, especially when visibly soiled or after using the restroom. Alcohol-based hand rubs are appropriate for hands that are not visibly dirty, but a full 20-second wash is the gold standard for many situations. For example, thorough hand washing removes germs that could otherwise be transferred to the client or the medication. Always remember, good hand hygiene means washing with soap and water for at least 20 seconds, a critical step to prevent infection. Question 23. A CMA is administering a rectal suppository. Which position is most appropriate for the client during this procedure? A. Sitting upright. B. Lying on their back with knees bent. C. Lying on their left side with the right knee bent towards the chest. D. Standing. Answer, C. Lying on their left side with the right knee bent towards the chest. This question tests your practical knowledge of proper client positioning for specific medication routes. For rectal suppository administration, the most appropriate position is Sims position, which involves the client lying on their left side with the right knee bent towards the chest. This position helps relax the anal sphincter, makes insertion easier, and allows gravity to assist in retaining the suppository. Other positions would be less comfortable or less effective for proper insertion and retention. For instance, trying to insert a suppository while the client is sitting or standing would be awkward and ineffective. Always remember, for rectal suppositories, position the client on their left side with the right knee bent. Question 24. A client reports feeling dizzy and lightheaded after taking their blood pressure medication. What is the first action the CMA should take? A. Reassure the client that this is a normal side effect. B. Tell the client to stand up slowly next time. C. Have the client lie down and then immediately report the symptoms to the charge nurse. D. Document the symptoms and wait to see if they improve. Answer, C. Have the client lie down and then immediately report the symptoms to the charge nurse. This question addresses recognizing and responding to potential adverse effects of medication, particularly those indicating hypotension, low blood pressure. Dizziness and lightheadedness after blood pressure medication can be signs of orthostatic hypotension or an overly reduced blood pressure, which could lead to a fall or other complications. The immediate priority is client safety, so having the client lie down can help stabilize their blood pressure and prevent fainting or falling. After ensuring immediate safety, you must promptly notify the licensed nurse for assessment and intervention. For example, if a client is dizzy, helping them lie down prevents a fall, which is the immediate safety concern. Always remember, ensure client safety first, then report any concerning new symptoms immediately to the charge nurse. Question 25. A client's MAR indicates they are due for a PRN pain medication. What does PRN mean in terms of administration? A. Administer only if the client requests it and meets criteria. B. Administer at regularly scheduled intervals. C. Administer only once per day. D. Administer after assessing the client's vital signs. Answer. A. Administer only if the client requests it and meets criteria. This question tests your understanding of PRN medication orders, which are different from routinely scheduled medications. PRN stands for pro re nata, meaning as needed. This means the medication should only be administered if the client expresses a need for it, e.g., reports pain, nausea, and meets any specific criteria outlined in the order, e.g., pain level above a certain number, specific time elapsed since last dose. It's crucial for the CMA to assess the client and ensure the criteria are met before administering a PRN medication. For instance, a PRN pain medication is not given automatically but only when the client says they are in pain and it has been long enough since their last dose. Always remember, PRN means as needed, requiring client request and meeting specific order criteria.